Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. What are selection tests? Selection tests include vocational preference tests or personality tests to be utilized in educational and occupational counseling. Selection tests can include the Graduate Record Examination, the GRE, or the Law School Administration Test, the LSAT. I would recommend looking into more types of selection tests and how it can better be utilized in a counseling setting. To help a client reduce avoidance behaviors, a counselor encourages him to begin attending school events gradually. This incremental exposure to increased levels of fear-provoking situation is known as A. Graded exposure, B. Desensitization, C. Flooding, D. Subjective distress. The answer is A. This incremental exposure to increasing levels of fear-provoking situation is known as graded exposure. So this takes small steps to increase the fear-provoking situations, such as having an individual stay for a minute at a social situation and then they can leave, and then increase it to 2 minutes and then they can leave, and then so on and so forth until they can attend the whole social event. And this is gradual over a duration of time. This is graded exposure. In some literature, group cohesiveness or we-ness is known as A. Group unity, B. A sociogram, B. Cartman's triangle, D. Transition stages. The answer is A. In some literature, group cohesiveness or we-ness is known as group unity when the group is working together and are bouncing ideas and communication off of each other, as well as improving coping skills, education, so on and so forth. It creates the group unity and makes the group stronger. What are placement tests? Placement tests are used to determine where a client belongs within a specific program. Some colleges may use these placement tests to determine which classes or courses a student should start off within a specific program of study. I specifically remember when I was going to college for the first time, I had to take a math placement test because, quite frankly, I am not good at math, and I had to start at a very lower level than other students because of where I placed. That is your real-life scenario of placement tests. A client recovering from opioid abuse lives in a shelter. His case manager is helping him secure independent housing, and he is currently in a detox program. Although he appears hopeful, he shares his anxiety about returning to normal life. He worries about reconnecting with his family. A counselor processes these emotions with him and realizes that he has dealt with anxiety for most of his life. What is a probable comorbid diagnosis in this case? A. Major depressive disorder, B. Antisocial personality disorder, C. Post-traumatic stress disorder, D. Generalized anxiety disorder. The answer is D. Generalized anxiety disorder is a probable comorbid diagnosis that the counselor has identified because the client has been dealing with anxiety for most of his life before he started his opioid abuse and now is in a detox program. And he is anxious about returning to a normal life and reconnecting with his family. I may have read a question or two in a previous episode. Sometimes this happens. I do try to catch it, but I am human after all. So thank you for listening. Keep calm and study on.